I would agree with the fact that everyone should have a psychodynamic assessment. The question is, at what phase and what is the framework in which this assessment occurs? And I bring this up mainly because as psychiatrists, we're operating within many different settings, the acute setting, the community setting, potentially in private practice, etc. So the broad question is, at what phase, and is it stretched over time, a longitudinal assessment, in order to get that particular assessment? Your thoughts?
Over a longitudinal amount of time, you tend to be able to build up history. So history taking is fine, but in a psychodynamic assessment, it's a very different approach. It usually needs to be a concentrated, usually 2 to 3 session phase, which is history taking, but also really critically evaluating the patient's defense mechanisms, their defensive styles, and trial interpretations. You want to clarify the frame in terms of the idea that we're doing this assessment to try to clarify what interventions could be of benefit for you, and going through a 3-session assessment to do this. And then after that, you're doing history taking, but you're also doing trial interpretations of things like, is it possible that the reason why you felt the way you did is because of what you said to me earlier about that time? And you're not doing these trial interpretations necessarily to provide therapy. You're doing these trial interpretations to evaluate the patient's responses to predict their defensive style, their defense mechanisms, and their resistances. Gabbard has described resistance management as the bread and butter of psychotherapy. Interestingly, also, Freud, without wanting to denigrate him too much, Freud thought that resistance was bad, a thing to manage and avoid. Most later analysts think about resistance as the thing that we do in psychodynamic therapy. Identify the resistance, break it down progressively and consistently in a therapeutic frame. Before you go on towards 2-3 years of psychodynamic therapy with a patient, the 3-session intervention is to evaluate what are the things that we're going to be seeing. So you can get the necessary history about what's happening with your patient. It's useful to do this when you get stuck. It's about the patients who aren't responding to things, the people who keep on returning, the people who have depressive symptoms, reactive affects, personality disordered features, and you're just not sure where you're going with them. These are the ones where trying a psychodynamic approach is not with the idea that they are going to go towards a psychodynamic intervention, but more simply that it gives you an opportunity to think about the patient in a different way, in a way that is potentially going to lead to them improving. There is something that happens inside psychotherapy called the third observer, which is where when you're regularly assessing a patient, you're encouraged to imagine yourself in the room with the patient, observing the interaction between the patient and yourself, and asking the question, what's going on here? So I was taught this by my supervisor, and I advise this to my registrars as well, that from time to time, while you're talking to the patient, imagine yourself in the room and ask yourself, what's going on here? And why I find that so amazing is because I've picked up incredibly good information from patients as a result of having that process.